Hello, in this video, we are going to briefly talk about infections that are caused by both E. coli and Salmonella enterica. So let's start with E. coli, the most famous bacteria of all. It is known to cause both urinary tract infections and gastrointestinal infections, as well as, different types of infections, but these are the two main clinical infections that we see from E. coli. So with urinary tract infections, it's going to be able to infect the urinary system, primarily the urethra, which is the tube that carries urine out of the bladder into, to the outside. And of course, urinary tract infections are more common in women because they have a shorter urethra. But the E. coli can also travel up the urinary tract, up the bladder, up the ureters, and honestly can go all the way up into the kidneys if it wanted to. So yeah, of course, the main symptoms are painful urination, bleeding in the urine, and of course, kidney damage if you let it keep going. Common treatments are just going to be regular antibiotics. So yeah. Now, for the GI tract, there are tons and tons and tons of different types of E. coli that cause infections of the gastrointestinal tract. And so in this table, it sort of summarizes some of the different strains that are involved. So it's not just one type of E. coli, but multiple types of E. coli that can cause some kind of GI tract infection, also known as food poisoning. And so, as you can see here, there's enterotoxigenic E. coli, which produces a toxin very similar to cholera, which gives you watery diarrhea. Whereas enteroinvasive has these plasmids that have invasive genes and also causes watery diarrhea. Enteropathogenic will give you non-bloody diarrhea, but then there will be fever and vomiting. And enterohemorrhagic will produce severe bloody diarrhea. So as you can see, different strains of E. coli have different genes that allow them to infect in different ways, which gives you different types of symptoms. So whether it's just diarrhea, diarrhea with fever, vomiting, bloody diarrhea, there's all different types. So that is E. coli in a nutshell. Let's move on to Salmonella. Salmonella enterica specifically is the main species of Salmonella that we see causing food poisoning. So there's two subspecies. There's Salmonella enterica enteritis. Okay. Anyway, this one is ingested through food, of course, so poultry, eggs, etc. Which is why it's important to cook your chicken all the way and all that. And what happens is when you consume this bacteria, it will go into your intestinal lining. It's able to actually penetrate. So this is a picture of the Salmonella bacteria burrowing into your intestinal lining, and eventually it will get into the bloodstream, cause fever, cramps, vomiting, diarrhea, the whole shebang. Then there's Salmonella enterica typhi, which is going to be causing typhoid fever, which essentially has the same symptoms as enterica. So fever, cramps, vomiting, diarrhea, except the symptoms are just much, much more severe, and you have a higher mortality rate. Typically with just regular salmonella infections, they're going to eventually go away. Not that many people get hospitalized, but with typhi, which is typhoid fever, then we're going to have extremely severe symptoms, and mortality rates pretty high, is 10%. Yeah. And with Salmonella enterica typhi, there are some individuals who we call the carriers. They have the organism in their digestive tract, but they don't have any symptoms. So whether it's because there's a low level of it or whatever, but they're just living together. And so these individuals can actually shed the bacteria through their feces. And so that's another way that can spread from one person to another. If that person, for example, handles food and they didn't wash their hands or something, then they can give their salmonella to somebody else. And again, these individuals would be asymptomatic But for the most part, most people are symptomatic and it's extremely severe, and we have a high mortality rate. All right, that's it for this video. Thanks for watching, and I'll see you in the next video.